Doctor, thank you so much for joining us this morning. First of all, we're going to start talking about, where we're at right now with the coronavirus health crisis, the pandemic. A lot of people are wondering, is it okay to go to the hospital? Is it safe right now to go to the hospital if you're not being seen for COVID?
It is definitely safe to go to the hospital. We've taken tremendous precautions, as you know, to protect not only our patients, but also any visitors and certainly all of our staff and our doctors. So certainly if you have symptoms that might be an emergency, we encourage you to come to the emergency department if you need to. Otherwise, you should always contact your private doctor first.
All right, what about the people who, they have stayed away from the doctor? They haven't been going in to get care because, people have been told to stay home, that if you go to the hospitals, go to see the doctor, you may be at higher risk. So they've been staying away and they have concerns about going in for treatment. What do you say to those folks?
Well, we are concerned about that. We've seen a significant decrease in volumes in our emergency department, mostly from sheltering in place. And obviously people are less active, there's less trauma and injuries and so forth. But there is a concern that patients may be deferring care for some symptoms, strokes, heart attacks, really some serious conditions. And really patients should not be afraid to come to the emergency department if they need to. And that's the main method that people come to the hospital, obviously. But now the hospitals are reopening for surgeries and elective or non-urgent cases. And those would be scheduled through your doctor or through the regular channels. And of course, we're taking many precautions to make sure people can be safe coming in for elective procedures as well.
Right, doctor. And we've heard a lot of talk about, some of these procedures we need to do to keep ourselves safe that include wearing the mask, continuing to wash our hands, the social distancing. You mentioned that some elective surgeries are coming back. So are you seeing, are all the hospitals doing that right now, or is it on a case-by-case basis?
No, all of our hospitals at Dignity, all 6 of our hospitals are reopening for deferred care or, quote, elective cases. And so, people sometimes wonder, what does elective mean? This doesn't mean, purely elective things like cosmetic surgery or that type of thing. Most of the time, these are necessary treatments that have been able to be deferred. So things like orthopedic procedures where perhaps you need a knee replacement or a hip replacement, something like that, that could be deferred, but now you really need to have that care, so we can provide it. So that's for Dignity. Certainly all of our hospitals are open. We began elective procedures or non-essential procedures, if you will, last week. And from talking to my colleagues, certainly around the Sacramento area, I believe all hospitals are back in business, if you will.
I think that's good to know because a lot of people have stayed away and been hesitant to go in, and it's always been a question of like, when is it going to be okay? So it's reassuring to hear that you guys are taking the precautions and starting to get those folks back in who may need that, like you said, knee or hip replacement. Now, as shelter in place relaxes and things start to open up again, what do you want people to remember to do or not to do when they're out in public?
So I like to think of this in terms of 2 sets of precautions. People should continue to mask, and that's primarily to protect others, so that in case you might be carrying the virus and don't know it, you might be asymptomatic, it's important to mask, and that protects other people. To protect yourself, the most important thing is social distancing. So if you're not getting close to other people, it's very difficult to have the virus transmit to you, and that's the most effective technique for persons to protect themselves. And then obviously, hand washing is still the order of business. The virus is still around. We know that it's prevalent in the community, and you can still catch the virus. So we need to continue those precautions.
And I think it is so important that you reiterated those points, because just because we start to open up, we can't be relaxed on some of the social distancing measures, on some of the hygiene things that we need to do, including masks. There's been a lot of talk about masks, especially in recent weeks, because we should all pretty much be wearing one, not only to protect ourselves, but to protect others. So one of our viewers asked, how often should we be washing reusable masks? Should we wash them immediately after each walk we take or each and every trip to the grocery store? Or is it okay if we do it less frequently?
So the rule of thumb is that they should be washed whenever they're soiled. And soiled means, dirty for some reason. Maybe, you touch something and then touch your mask and there's obviously dirt or something on it. But they also get soiled from the inside as we breathe. They get moistened, they get secretions from our nose and mouth. And so as they become certainly wet or soiled on either side of the mask, they should be washed. For most people, that's once a day. If you're not using it, very frequently, maybe a couple of days. But certainly, 3 days, 4 days, if you haven't washed it, you should wash it. They are washable, and soap and water is highly effective against the virus. So that's a really effective way to protect yourself.
Doctor, we've certainly been keeping the washer dryer a little bit extra busy at my house when it comes to cleaning. Now, what should we be paying attention to in order to get an idea of whether or not we're opening too quickly or if we can relax things even more? I know it's a fluid situation.
Well, it is. We're monitoring the prevalence of the disease in the community. We're tracing contacts. We're doing everything we can from an epidemiology basis to track the progress of the disease. We see that it's really fairly steady at this point. And so I think continuing the precautions that we're doing at the pace that we're doing them is what should happen. Now, we're all worried about a surge. And if we begin to see an uptick in cases or there's a surge, we may ask people to double down on the precautions. And there may be even a shelter, back to sheltering in place completely at some point. But we're hoping that doesn't happen. And really, that depends on everyone participating, everyone observing social distance and masking. If we all do that, then the virus doesn't have the opportunity to surge.
And you mentioned this possible surge. A lot of people have been speculating about a second wave. Do you have any expectations for when that could be or what will happen?
Well, the discussion is that, perhaps in the fall or certainly in the winter, that seems to be the season for most of the respiratory viruses. And this is primarily a respiratory virus. It does tend to pattern after the regular influenza. So we're sort of, this is a novel virus. We're learning a lot about it, and there are some unusual features to it. So we don't want to completely categorize it as just another flu, which obviously it's not. But it does tend to, we think it will pattern after the flu. So we're looking at fall as a potential surge or winter, and hopefully as we keep social distancing and we keep our precautions going, we won't see that surge. But we're prepared for it in case we do.
All right, Dr. Richard Carvolth with Dignity Health, thank you so much for joining us. Great information. We appreciate the updates.
Okay, thank you for having me.
This interview involves commercial content. The products and services featured appear as paid advertising.